Introduction. A bone scan, also known as bone scintigraphy, is a nuclear medicine imaging study that involves the use of radioactive tracers to help diagnose various kinds of bone disease by detecting abnormal changes in bone metabolism. Bone scans are often used to track the spread of cancer from other parts of the body, such as the prostate gland or breasts, to the bone and assess the response to treatment. Indications. Your doctor may order a bone scan to identify the cause of unexplained bone pain, bone infection, and bone injuries that might not be visible on standard X-rays. The wide range of bone disorders that may be diagnosed by using a bone scan include arthritis, fractures, bone cancer, osteomyelitis, infection of the bone and joints, avascular necrosis, death of bone tissue due to lack of blood supply, Paget's disease of the bone, disorder of the bone remodeling process. Contraindications. Bone scans are not recommended for pregnant women due to the possible harmful effects of the radioactive material to the baby. Preparing for a bone scan. You do not have to follow any dietary restrictions prior to undergoing the bone scan. However, you should inform your doctor if you have taken any medication containing bismuth or have undergone an X-ray with the use of contrast material, as this may interfere with the results of the bone scan. Are allergic to medications, contrast dyes, or iodine. Nursing mothers should feed their baby right before the procedure and then interrupt breastfeeding for 24 hours after the procedure, pumping and discarding the milk produced during that period. Bone scan procedure. The bone scan procedure involves the following steps. You are asked to remove any metallic objects and jewelry. A tiny amount of radioactive tracer is injected into your vein. You may have to wait a little while and drink a few glasses of water as the tracer circulates throughout the body. After enough time has elapsed, you are asked to lie on an imaging table and a tracer-sensitive camera is passed back and forth over your body. The areas of bone that are damaged and undergoing repair tend to take up the largest amounts of radioactive material and are highlighted on the scan. Interpreting bone scan results. The results of the bone scan will be interpreted by a radiologist who is specially trained to look for signs of abnormal bone metabolism. Abnormal areas of bone that absorb large amounts of the tracer material will appear darker on the scan and are known as hotspots. Normal areas of bone that do not absorb large quantities of the tracer will appear lighter on the bone scan and are known as cold spots. Post-procedure care. You can return to your routine activities immediately after the procedure, as no follow-up care is needed. The tracer is usually eliminated from the body within 2 days. Risks and complications. There are minimal side effects from a bone scan as the tracer material produces negligible amounts of radiation exposure. You may feel a pinch during the needle insertion or experience bruising in the area. Rarely, allergic reaction to the dye can occur. Summary. A bone scan is a highly sensitive test that detects abnormal changes in bone metabolism. Depending on the results of the test, your doctor might order further testing to accurately diagnose and treat your condition.